Hello, and thank you so much for watching our short film about patient and public involvement at the Oxford Health Biomedical Research Centre. My name is Claire, and I'm the Patient and Public Involvement Manager at the Centre, and it's my great pleasure to be talking to you today. This short film is an introduction to involvement at Oxford Health Biomedical Research Centre. It covers what is the Biomedical Research Centre, what is patient and public involvement, how can involvement change research, what difference does it make, and why do people get involved? What are their experiences? In putting this film together, it's been great to talk to Jane, one of our involvement contributors, and Susie, one of our researchers. And you will hear from them both in a little bit, talking about their experiences of involvement. The Oxford Health Biomedical Research Centre brings together the NHS with the University of Oxford to take forward research into mental health and dementia. We aim to transform the latest science into better personalised treatments and care for patients. Current work at the centre has included research on COVID-19 and mental health, including long-term impacts, a programme for frontline health workers at risk of depression, exploring the benefits of online cultural experiences, such as the Ashmolean's digital collection on mental health, and guidance for the delivery of remote psychological therapies. What is patient and public involvement, and how does it fit into our research? Patient and public involvement is when patients, carers, service users and members of the public work with researchers to help shape and inform what research is done, how that research is designed and carried out, and how the results can be widely shared. It is different to being a research participant when you take part in the study itself. Getting involved in research might include discussing with researchers what matters to you about the topic they're exploring, helping them create a plain English summary of their research, providing input into how their study is designed to make sure it is accessible for people to take part in, and helping to develop clear information for future research participants. We offer patient and public involvement contributors payment for their time and expenses. No specialist knowledge or skills are needed. There are no right or wrong answers. What is important is that you bring your own views and experiences to positively help research be the best it can be. Patient and public involvement genuinely helps to shape our research. To find out more about how patient and public involvement influences research, I spoke to Susie Murphy, a senior research fellow at the Biomedical Research Centre, about her experiences of patient and public involvement in research. So hi Susie, thank you so much for joining us. I wanted to start by first of all asking you just to introduce briefly the sort of research that you work on.
Hi Claire. So my name's Susie Murphy. I work in the Department of Psychiatry at the University of Oxford, and my research is really focused on looking at treatments for disorders like depression and anxiety, and thinking about the best way that these can be treated, both using existing treatments like antidepressants, how these might best be combined with more psychological treatments like cognitive behavioural therapy, but also thinking about new treatments that are being developed. So I work alongside the pharmaceutical industry to help them think about the best way to develop new treatments for depression and anxiety.
Great. And could you tell me a bit about how patient and public involvement has been involved in your research and the sort of differences that it's made to your research?
So yeah, we really value involving patients and the public in our research, and it's really important to do this at all sorts of different stages. So we consult with groups of people that have got experience that's relevant to the questions that we're asking right at the beginning, when we're starting to think about what the interesting questions that we might ask with our research might be, all the way through to when we're thinking about a study, involving people in terms of whether we're planning it in the right way, whether the leaflets that we're using to advertise the study are understandable, and then all the way through the research cycle, all the way to the end of the process, thinking about what's the best way to tell the public and people for whom it's relevant about this research. And we've really found over the years that every time we involve patients and public in our research, it gets better. So we start thinking about questions in a slightly different way. We even think about new research questions that we wouldn't have even considered before. And our research becomes more and more relevant to the people for whom it matters and for who hopefully it will make a difference to.
That's really interesting. Have you got examples of any sort of PPI projects that you're involved in at the moment at all?
Yeah, so we're currently involved in a a project that it's funded by the Wellcome Trust, and we've been commissioned to do a piece of work which will ultimately result in a review looking at the use of antidepressants in young people, so in adolescents. And the kind of PPI element of this is completely central to this work. So we've recruited a group of young people who have got lived experience of depression, or in some way lived experience of decision making about whether to use antidepressants or not. And we've embedded them in the process. So we've been talking to them about the questions that we're asking in this review. We've been asking them to generate their own ideas for the kind of critical questions that should be asked in this field that aren't being asked at the moment. And we've been telling them about what the science says. So we've been reading all of the papers in this area and then asking them both whether they think that this science is addressing the critical questions, but also whether we're explaining it in a way to the public that is useful and accessible. And what's really interesting in that project is that actually, even from the very first time that we met with the young people, it became evident that the questions that they were interested in, so the things that would really matter to them when making the decision about whether antidepressants were the right thing for them to be taking, or for any young person to be taking, these things weren't being represented in the research that was being done. So if you read the science, it's a kind of set of relatively dry questions about, is this antidepressant better than placebo, and those kinds of questions. But the young people had a much broader perspective. They wanted to know, if I take antidepressants, how's it going to affect my ability to go to school? How's it going to, will it affect my grades? How will it affect my sleep? How will it affect all aspects of my life, my interaction with my parents, those kinds of questions? And actually coming out of that process, we've got a much richer sense of the research that needs to be done in this area. And so when we ultimately go back to the Wellcome Trust with our review, we will have just a fantastic perspective from the young people about what really matters to them.
And that's really exciting, isn't it? Because that means that in future, the research can really focus on the information they would want if they were making those decisions. So that's, so valuable.
Yeah, absolutely. Yeah.
Great. Okay, well, thank you so much, Susie. That's really interesting. Thanks.
Pleasure.
Why do people, patients, carers, service users and public members choose to get involved in research? In talking to our current contributors, there are many different reasons. For some people, they want to use their experiences of services and treatments to help improve options for future patients and service users. For others, it is an opportunity to learn more about a health area or about research itself. Some people have talked about involvement as helping to provide hope and of being of value. Others enjoy connecting, sharing experience and using their existing skills and knowledge in a new environment. Whatever the reasons, we work to make sure being involved in our research is a positive experience. As mentioned earlier, we offer people who are involved a payment for their time and expenses, and we also provide support and training opportunities to help you get the most out of being involved. I spoke to Jane, one of our current PPI contributors, to find out about her experiences of involvement. Hi Jane, thank you so much for joining us. Jane, just to introduce you to everybody, you are one of our sort of regular patient and public involvement contributors, and you're a member of our patient and research strategy group. Is that right?
Yes, it is. Yeah.
What I really wanted to ask you about was how did you first get involved in patient and public involvement?
Actually, I literally was at the hospital. I just had a psychotherapy appointment, I think it was, and I was sort of wandering out slower than I normally would, I think, because my mind was full of thoughts, from what I'd just been doing. And I just paused and I saw this, advert, for want of a better word, on the wall, and I read it. And I think there was a little tear-off slip at the bottom with a phone number to ring. And it was, about joining the PAR group, patients and people helping with research. And I thought, that's something I am interested in. And I must have been at that moment where I thought, maybe I could give it a try. Maybe I'm nearly ready to do that. So I took the little bit of paper and I rung the number the next day. personally, I was helped an awful lot by the fact that the person I spoke to said that they, you know, were really encouraging people to come from different areas, and they very kindly said that they would provide payment for the taxi for me, and that made the difference between me being able to attend or not, to be honest. And has continued to do so. So that's how I got involved.
Really interesting. And have you got an example of a patient and public involvement project that you've been part of, and what sort of activities, you know, have been part of that, so give people a sort of a sense of what's involved?
Yeah, for me, it's been a sort of gradual process of doing smaller things and moving on to bit bigger things. And you know, so yeah, it started with just reading documents and perhaps giving suggestions as to how they could perhaps be more public friendly. I enjoy doing that, and that's something, you know, that I think I'm quite good at, actually, sort of plain English stuff. And then I think if I talk about something that I've done more recently that I really enjoyed, I being part of the Cozy project, I think it's called, and helping with that in a discussion situation with researcher.
What is it that you enjoy the most about the patient and public involvement that you're
I enjoy being part of something. I really like the actual past strategy group meeting with people who we've now sort of got to know and feel quite comfortable with, and having the sort of debates and discussions that take place there. I feel that you know, I feel we're really listened to, whatever our position is in that group, and that what we're doing is actually useful in sort of moving things forward, and the sort of pointing in directions that maybe people should think about going in with regards to research. So I enjoy the company of other people. I enjoy being a part of the group. I enjoy feeling that actually I do still have a brain and I can use it, and it still works despite all the other problems I may have had along the way, or have along the way. But it's a being in part. I think being part of something really is the most important thing, and it has definitely built up my confidence in that area when I probably, you know, had lost most of that, actually. So yeah, that part of it is really good.
Is there anything else that you think you'd like to share about patient and public involvement at all?
I think even during the time that I've been involved, and I think probably that's a few years now, actually, I feel that the respect for the work that you do, and you know, the using the PPI in research, etc., has definitely grown, and it's probably respected a lot more. I think that one thing I really have appreciated, and I suppose didn't really expect it to get from this, is all the training, which has been amazing. It's all free, and it's all we had a sort of went through the whole of the research cycle by having sort of different sessions with different people inputting, and yeah, they were really good courses, and I really enjoyed learning about it. And I think having learnt a little bit more about how it all works does help me know when I'm in a, you know, asked to be involved in a research project in some way, I can sort of work out for myself where in that cycle I'm involved. Obviously, I guess my ambition as such, if you can have that with this, is to one day be involved in the whole cycle of a research project, or at least a little bit more than just dipping in and out. But for now, that's fine. And if we help, that's great.
Brilliant. Thank you. Thanks so much, Jane. That's really interesting. Thank you so much to Susie and Jane and all the other people who've contributed their feedback to this video. And thank you so much to you for watching. If you'd like to find out more about how you can get involved in our work, please do get in touch. We'd love to hear from you. Thanks.